Today, I think as you've heard, the life of an individual with complex mental illness is difficult. And in fact, it's 20 years shorter than that of the general population. Our patients at CAMH die of unrecognized or poorly managed diabetes, heart disease, stroke, and cancer. The stigma of mental illness, prejudice, and discrimination play a big role in this inequity. Today, we'll be talking about healthcare for people with mental illness. Patients with complex mental illness bear a burden of physical illness that's greater than that of the general population, but they experience serious barriers to the care they need and deserve.
The Medical Psychiatry Alliance was born out of the need of a unique approach to handling patients with a simultaneous physical and mental illness. We're celebrating the return to the mind, body, spirit philosophy that we have lost over recent years. For some reason, we separated the mind from the body many years ago, and we're working hard to bring them back together. Because the reality is, lots of people with mental illness also have serious physical illness. And if they aren't treated together, we just don't provide the highest quality care.
Being part of a collaboration involving world-class organizations coming together with the support of philanthropy and government confirms my belief that Ontario is truly a hub of innovation and inspired leadership.
We need to make the system easier. That's what our patients told us when we went out and spoke to over 23,000 of them. We need to break down the barriers to access, and particularly in this patient population. We need services inside and outside the hospital to be connected and to be understood better. And we need to design a diverse set of services that are built around the patient, not the hospital.
Our critical mass of clinical and health sciences resources and our array of community supports makes us a powerhouse of innovation in healthcare, research, and education, not only for Ontario and Canada, but indeed for the world.
So it's a huge landmark day, way more than just the announcement of a new investment. This changes how people with mental illness will be cared for in our healthcare system, and that's why I'm so thrilled to be here and so proud of the leaders who brought this idea forward.